Arun, can you check doctor's login?
Sir, he is logged in now. Just a second. Just few seconds.
Good evening, students. Doctor will join anytime now in another 1 or 2 minutes. He got delayed because of his OPD. So give us another 1 or 2 minutes. Sorry for the inconvenience.
Join. Hello, Rajesh sir. Hello.
Arunji, बोलिए.
Yes, Doctor sir is here.
Is there?
Hmm.
Where is his ID? What is his name? Coming as Sanjeev Kumar is not seen. Just a minute. Dr. Sanjeev,
Doctor.
you are able to hear?
Yeah.
Dr. Sanjeev, you are able to hear? Hello? Hello? Dr. Sanjeev? Arun, can you just check?
Rajesh sir, just give me 1 minute. I think some new problem is there.
He's logging in from your ID.
No, no, no. He is logging from the system.
But his name is not seen in the
Just a
login.
moment. Just a moment. No, okay. Some mute problem. Only select button on. What is mute problem? मैं अपने sir, Rajesh sir,
हाँ जी बोलिए.
I think Doctor sir laptop has some problem. So Dr.
You are
Sanjeev will join my ID, है ना?
you are there, na?
हाँ.
You are there with the doctor. So can you rename this as by any chance?
कर दीजिए.
Can you open? Can you on the camera?
Just a moment. Rajesh, sir, sorry, actually that is a technical issue is there for mute purpose. So we'll start in just a second. Sorry for delaying.
No problem. But can we do it with this now? With your login?
Yeah. From my From my ID, the sir will start to give his presentation.
Yeah. So you can just share the presentation.
Just a moment.
Yeah.
चलेगा. ठीक है.
हो रहा मिस्टर अरुण हो रहा है क्या?
या तो 2 मिनट में बस.
Dear student, we will start in another 2-3 minutes. I'm sorry, there was some technical glitch. Because of that, we got delayed. Doctor is just setting the presentation now. And then we will start in just 2-3 minutes. Sorry for the delay and inconvenience.
Nursing sir is there. Hello, nursing sir.
Hello. Yeah, Arun,
Yeah, of course. It's done. It's done.
can you share the presentation?
Yeah, of course. Screen. Now my screen is visible to you.
Yeah, it's coming. Just waiting for the PP to get uploaded.
It's visible to you.
Yeah. Can you make it full screen? Full, full slide. Yeah. Can you move the slide one or two so that we can see the movement?
Yeah.
Hello, Dr. Sanjeev.
Yes, hello.
Good evening to you. Thank you for accepting the invite and being here in your busy day. Thank you very much.
Yeah, welcome. And sorry for the little late. There was some technical issue with my computer.
No problem, sir. We can understand that. No problem. So, Mr. Ashford, should we start the proceedings, sir?
Yes, please.
Yeah.
Please.
So, somebody from your side will introduce the doctor.
Yes, Ronak will do that.
Yeah. So, Ronak, can you do the needful?
Yes, sir. Good evening. They say that good doctors understand responsibility better than privilege and practice accountability better than business. A testimony to this statement was evident during the first wave of the novel COVID-19 pandemic that crippled the world. When pharmaceutical companies were extensively researching and experimenting to find a vaccine that could build resistance through immunity, the frontline workers were battling the invisible. Many doctors lost their lives while saving the others, while many others stayed away from family for days on end. Yet they remained undeterred and resolute. Such was the loyalty to the profession. Needless to say, we have and always will hold these medical practitioners in high esteem. Today, ladies and gentlemen, we have with us one such recognized eye doctor from our very own city of Dehradun, who has strived tirelessly to help his patients. Dr. Sanjeev Kumar is a doctor at Ramrati Eye Hospital in Dehradun and is one of the youngest leading doctors of his discipline in the city. Dr. Sanjeev completed his MBBS from KIMS Bangalore under the Rajiv Gandhi University of Health Sciences, Karnataka in the year 2006. He also passed the DOMS Ophthalmology from Jawaharlal Nehru Medical College, KLE University, Belgaum in the first attempt. He has done various fellowships including FICO, an anterior segment and IOL fellowship from Arvind Eye Hospital in Tamil Nadu. Dr. Kumar has also attended numerous state and national conferences. We are thrilled to have you today with us this evening, sir. Dr. Kumar will be addressing the gathering on dry eyes. Dry eye disease is a common condition that occurs when your tears aren't able to provide adequate lubrication for your eyes. To further elaborate on the causes, symptoms, and prevention of dry eyes, I hand over this evening's proceedings to Dr. Sanjeev Kumar.
Yeah, thanks a lot. Thanks for my nice introduction. Shall I proceed?
Yes, sir.
Yes, sir.
Yeah. This talk is just awareness about the dry eye, and I'll just go with the little explanation and the practical tips how to prevent dry eye and how to go ahead with it. Eyes help us to see the world around us. First, I'll just explain a little bit the anatomy of the human eye. The human eye is divided into the cornea, iris, pupil, and lens. Cornea is the transparent structure through which we can see the objects by focusing effect of the lens. The functions of the cornea, it performs 70% of the focusing, protects eye from the outside world, and is a avascular structure. There is no blood supply of the cornea and is a transparent structure, cleaned and nourished by the tears from outside and the aqueous humor from the inside. The cornea, the aqueous humor, is present between the inner layer of the cornea and the outer surface of the lens. The functions of the iris. Iris controls the amount of the light entering into the eyes. It adjusts the size of the pupil according to the intensity of the light received by the eyes. The movement of the pupil in response to changing light's intensity helps in maximizing the visual perceptions. In the bright light, it contracts, and in dim light, it dilates. The contraction and the dilatation depends upon the sphincter pupillae and the dilator pupillae of the iris muscles. When the sphincter pupillae contracts, the pupil will be the small inside, and when the dilator pupillae will contract, it will dilate the pupil. The function of the lens, it maintains the clarity, provides the refractive power, allows the eyes to clearly focus objects within a 6-meter range, prevents damage from the ultraviolet rays from reaching the retina. When the clouding of the lens occurs, then we say this condition cataract, means it's a white cloudiness of the lens. The normal term is the motia bindu. White motia bindu we call as a cataract, and the same thing is the black motia bindu is we tell it's a glaucoma. The glaucoma is basically the optic nerve disease, and the cataract is a cloudiness of the lens. Now comes to the tear film. The tear film contains mainly 3 layers: the mucin layers, aqueous layers, and the lipid layer. The outermost the layer is a lipid layer, and the innermost is the mucin. The mucin layer is the adherent to the cornea, and the lipid layer is the outermost layer of the tear film. The tear film is the liquid layer which consists of the lipids, water, and mucin that coats the outer surface of the eye and lubricating it. Out of these 3 layers, the 80 to 90% of the volumes contains the aqueous layer. The importance of the tear film. A healthy tear film is important for optimal vision and protection of the surface tissues of the eye. The functions of tear film, it provides 80% of refractive power along with anterior surface of the cornea for focusing. Lipid layer provides lubrications which gives comforts, and mucin layer is the innermost layer which reduces the shear force related to the blink cycle. Tear film protects from the insults. The tear film contains the lipid layer. This protects the mucosal surface against desiccating environment, and it contains so many antibacterial proteins, and which includes the lysozyme, lactoferrin, and peroxidases, which protects the cornea from the bacteria. This provides nourishment to cornea. It maintains pH, promotes epithelial cell growth and wound healing, maintains a reducing environment. How these tears produce? The tear produced from the lacrimal gland. From the lacrimal gland through the lacrimal ducts, it comes into our eye, and from that eye there will be the 2 punctum, means on the medial canthus there will be the upper punctum and the lower punctum. Through this punctum, it goes into the nasolacrimal duct, and from the nasolacrimal duct, it will go to our throat cavity. Then, what is dry eye? Dry eye is a condition where the eye does not produce enough quality tears to lubricate and nourish the eyes properly. Quality as well as quantity of the tears are affected. First is inadequate amount of the tears, and second is the poor quality tears. Poor quality tears, it comes when the outermost layer, the lipid layer, will be disturbed, then the quality of the tear will be poor. What are the causes of the dry eye? Dry eyes are experienced by majority of the people over 65 years. As the age progresses, the capacity of the eye to form the tears increases. Because of that only, the old people, they will experience the dryness of the eye. Again, gender. Women have more chances of having dry eye due to hormonal changes, which can be due to pregnancy and use of the oral contraceptives and the menopause. Medications. Medications such as the antihistamine, and antidepressants, all decreases the tear production. Medical conditions, people suffering from the diabetes, thyroid problems, and rheumatoid arthritis are more prone to have dry eyes. The environmental condition, those people who are more exposed to the windy and the dry climate, exposure to the smokes, can increase the tear evaporation, which increases the risk of dry eye. The other factors, staring at the gadgets screen for the long times resulting in the less blinking, and the use of the contact lens, refractive eye surgery such as LASIK. Some inflammatory conditions, connective tissue disorders, Sjogren's syndromes, graft versus host disease, and juvenile rheumatoid arthritis, congenital disorders like familial dysautonomia, Elgrove syndrome, and the poor nutrition. The poor nutrition, if people are not taking enough of the green vegetables and the yellow fruits, that makes less tear and aggravates the dryness problem. The causes of dry eye in the kids, again, the juvenile diabetes, some systematic medications, the environmental factors, this all aggravates the dryness of the eye. The other common causes of the dry eye, the most common causes we see here day to day is the meibomian gland dysfunction, which mainly we see in the old age. What is the meibomian gland dysfunction? In our upper and lower eyelid, around 200 meibomian glands will be there. And if there will be any dysfunctions, if there will be any excessive secretion from the meibomian gland, there will be some paste-like and the oily secretions from the glands. And that oily secretions that will disrupt the lipid layer of the tear film. When the lipid layer of the tear film will disturb, then there will be the breakage of the tear film, which will be present on our cornea, and that aggravates the dryness. We see this problem in old age patients around 60-65 years. The MGD, the meibomian gland dysfunction, is the most common. Again, the smoking in terms, it will increase the dryness of the eye. And what we'll do means, right now the people are on the online classes, they are using the electronic gadgets, system, laptop, mobile. So after half an hour and 45 minutes, they will complain of some burning and stinging sensation of the eye. What they do, they just go and they wash their face and wash their eye. And there will be the one tear film on our cornea. If there will be the excessive washing of the eye, the tear film will break. And once the tear film will break, after washing of the face, immediately within 5 minutes, the people will experience a little comfort. But after half an hour, again, all these problems will start. So we should not wash excessively of our eye. Within a day, 2 to 3 times you can wash, not more than that. And again, all the eye surgery, especially the cataract, LASIK, and any eye surgery that will break the tear film and that will aggravate the dry eye problem. The symptoms of the dry eye. The dry eye symptoms are the redness. The patient will experience the redness, pain, fatigue, a stinging on burning sensation, uncomfortable with the contact lenses. The source of the blurring will increase. Means patient was normally the computer users, they complain in the morning time they will start and they will feel comfortable. After 4 to 5 hours, they will start experiencing burning and the irritation in the eye. And at the end of the day, means by the evening and night, they will get the headache and all. This is a typical sign and symptoms of the computer vision syndrome. They will feel sandy and gritty feelings. There will be the feeling that some foreign body is there in my eye. Decreased tolerance to the sustained visual attention. When you work on the system laptop, after sometimes there will be the intolerance, means they will not able to concentrate on any electronic gadgets, and decreased tolerance to the screen time. And what is computer vision syndrome? Today's talk is more and less related to the computer vision syndrome. We call the computer vision syndrome to the digital eye strain. It occurs due to constantly focusing the eyes on a computer or any other electronic gadgets for long periods of time, resulting in inability of eye muscles to recover from the strain. It results in the chronic dry eye, and this condition, when we do daily, it will result to chronic dry eye. The increasing computer uses, and from the last 2 years, because of this COVID pandemic, the internet users are day by day increasing. And if you see the Asian countries have the maximum internet users in the world. Why does this computer vision syndrome occurs? Because computer screens are made up of pixels or tiny dots, which is hard for eye to focus. The computer users must therefore focus again and again to keep the images sharp. This results in receptive stress of the eye muscles. Dry eye occurs due to the lower blinking rate of users. As we stare on the gadgets, the blinking rate will reduce. And this computer vision syndrome does not occur through the use of the computer. It occurs from the laptops, televisions, smartphone, tablets, and any other visual aids and any other electronic gadgets. What are the symptoms of the computer vision syndromes? The patient complain of the eye strain, sore or fatigue eye, slow change in the focus, headache, irritation in eye, pain in the neck, back, and shoulder. And most common, they will complain some foreign body sensation in your eye. When this tear film will break, there will be the foreign body sensation in eyes. The normal blink rate is 14 times per minute, but when you use the computer electronic gadgets, the blink rate comes down, and it's just a 4 to 6 times per minute. This air conditioning also doubles the risk of the dry eye because it will increase. It will cause the low humidity, chill environment. This causes the evaporation from the aqueous layer. Daily exposure to the dry eye can cause uncomfortable situation to progress with chronic change in the tear film. This all exacerbates the dry eye symptoms. Air condition in cars also, it will increase the tear evaporation. So whenever you are sitting in any vehicle, try to just move the blow of the air away from your eye. And if there will be any direct blow of air on your eye, then this dryness will occur. Frequent air travels also exacerbates the dry eye symptoms because the average humidity in the aircraft cabin is 9 to 28%. That means 23 to 24 degree, which is relatively low. It increases tear evaporation. Symptoms have direct correlation with the duration of the flight. As the duration of the flight is more, the dryness will more. Occurs in many people who otherwise do not have dry eye complaints or problems. Why you should not ignore the dry eye symptoms? Because it will cause the eye infections, our tears protect the surface of your eyes from infection. Without adequate tears, you may have an increased risk of the eye infection. Damage to the surface of your eyes, if left untreated, severe dry eyes may lead to the eye inflammation, abrasions of the corneal surface, corneal ulcer, and vision problems. This decreases the quality of the life. Dry eyes can make it difficult to perform everyday activities such as the reading, watching television, and any other performance which is related to the eye, that all subsided with the dry eye symptoms. These are some 10 steps to get relief from the computer eye strain. First, we get a comprehensive eye examination. Computer users should have an eye examination before they start working on a computer at least once a year thereafter. During your examination, following things are noted: how often you use in computer at work, at home, measure how far your eyes from your screen. Use proper light. Eye strains often is caused by excessively bright light, outdoor or interior. Ambient lighting should be about half as bright as that typically found in most offices. This eliminates the exterior light by closing drapes, shades, or blinds. Reduce interior lighting by using fewer light bulbs or fluorescent tubes, or use lower intensity bulbs and tubes. Position your computer monitor or screen so windows are to the side, not in front or behind it. Third measure is minimize glare. Glare on walls and finished surface as well as reflections on your computer screen also can cause computer eye strain. Consider installing an anti-glare screen on your monitor. If you wear glasses, purchase lenses with this anti-reflective coating. With anti-reflective coating, we can go with the blue coated lenses. Nowadays, we normally advise the blue coating lenses. What this blue coating lenses what they do, all these electronic gadgets, mobile system, laptop, from that the blue rays comes, the blue rays radius, and that will affect your eye. And this blue coating lenses, which is present on your spectacles, that will screen the blue lights, and with this screening, this will reduce dryness of your eye. Upgrade your display. LCD screens are better than the old tube style monitors. Choose a screens with highest resolution possible. Choose a relatively larger display. Select a display that has a diagonal screen size of at least 19 inches. That means ideally desktop computers are good because their distance will be the 19 inches. Adjust your computer display setting. Keep the brightness same as of your surrounding workstations. The text size and contrast. The best is on a computer screen, black text on a white background is best. Other light contrast, dark on light combination works well also. Avoid low contrast text, background and color scheme, and text on a busy background is also tiring to read. Blink more often. Blinking is very important as it moistens your eyes, which prevents dryness and irritation. Every 20 minutes, blink 10 times by closing your eyes as if falling asleep, means very slowly. This will help to re-wet your eyes. Exercise your eyes. Constant focus on screens eye results in the strain, tiring, and fatigue. And the best exercise is this a rule of the 20-20-20. Look away from your computer at least every 20 minutes and gaze at a distance object at least 20 feet away for at least 20 seconds. This rule is called rule of 20-20-20, means after working on any screen, after 20 minutes, take a break for the 20 seconds and look at a distance which is 20 feet away. Another exercise is to look far away from an object for 10 to 15 seconds, then gaze at something up close for 10 to 15 seconds. Then look back at the distance object. Do this 10 times. This prevents the accommodation spasm. What is accommodation spasm? Accommodation spasm is a contraction of our ciliary muscles. When you work more on the system, laptop, mobile, our ciliary muscles will get contracted. Because of that, we experience the accommodative spasm. The symptoms of the accommodative spasm will be the headache, fatigueness, and unable to concentrate on the screen. These all are the symptoms of the accommodative spasm. But if you do this exercise, if those who are working more than 6 hours on the computer, they have to do some eye exercise to get relief from this accommodative spasm. And again, don't forget to blink during your exercise. Take frequent breaks. Take at least 15 breaks. Additional 4 mini breaks of 5 minutes recommended. By you doing so, work output indeed maintained or increased. During your computer breaks, stand up, move about, and stretch your arms, legs, back, neck, and shoulders to reduce tension and muscle fatigues. Modify your workstation also. Place written pages on a copy stand adjacent to the monitor. Light the copy stand properly. If using a desk lamp, make sure it does not shine into your eyes or onto your computer screen. Adjust workstation and chair to the correct height. position your computer screen at least 20 to 24 inches from your eyes. This is very important. Your computer and any laptop and system that will be 24 inches away from your eye, and the center of your screen should be about 10 to 15 degrees below from your eye level. There should not be a direct contact from your eye to the screen. Means when you look at the screen, there will be some angle, at least 10 to 15 degree below from your eye. That will be the comfortable position of your head and neck. And your spine will be the erect. There should not be any irregularity on your back. You should stand, you should sit in an erect position, and this monitor distance and the angles would be very important. Those who are working more than 6 hours on the computer. Consider computer eyewear, means modify your eyeglasses to create the customized computer glasses. As I mentioned, the blue coated lenses nowadays are more suitable for the computer users. With the blue coated, you can go with the ARC coating, means anti-reflective coating. Computer glasses are also good choice if you wear the bifocals and the progressive lenses. This is especially true if you normally wear contact lenses, which may become dry and uncomfortable during your sustained computer work. So if you're working more than 6 hours and 4 hours on the system, so instead of the contact lenses, we can go with the computer glasses. Tips to stimulate the tear production: drink plenty of the water. Include sources of the fatty acids in that: flaxseed, fish oil, almonds. Eat fruits and vegetables which is rich in the vitamin A and E. Normally practically we say to the patient, eat the green vegetables and the yellow fruits. All the colored fruits and vegetables are rich in the vitamin A in either in other form. It will be present in the carotenoids, yeah, vitamin A. So they are very rich. So we normally say eat plenty of the green vegetables and the yellow fruits. Avoid eating too much of the meat, fats, and carbohydrates. When to contact a medical professional? If after doing all these things also you are feeling that your eye is red or painful eye, flaking and discharge, yeah, any lesion on eyelid because of the dryness, and these all things, ultraviolet exposure, the fleshy mass comes on our cornea. We say it's a pterygium. And the previous trauma to the eye, any bulging eye is a sign of the keratoconus. If you are having the dryness, so what they tend to do, when our eye get dry, we start feeling itching in your eye and we start rubbing in the eye. When you do the rubbing more, there will be the bulging eye, and this conical cornea we say is a keratoconus. Again, some joint pain, swelling and stiffness, this indicates the connective tissue disorders. The patient can have the rheumatoid arthritis, osteoarthritis and all. Other than osteoarthritis, the rheumatoid arthritis, which is connective tissue disorders, they are more prone for the dryness. Dry mouth, dry eyes not responding to the self-care measures within few days. In summary, when enough quality tears are not produced by the eye, there is occurrence of the dry eye. Due to this, the lubrication and the nourishment of the eye is insufficient. Computer vision syndrome, a digital eye strain, is one of the major reasons for the dry eye. To avoid dry eye, efforts should be made to stimulate the tear production. In case of the severe problem, contact a medical professional. So in summary, this talk is mainly related to the computer vision syndrome, because from the last 2 years, we are more prone for this system, laptop, mobile, online platform, the virtual conference and all. So eat plenty of the green vegetables, take a break, means after 20 minutes of the work, take a break for the 20 seconds, look at the 20 feet distance. And whatever the electronic gadgets you are using, just decrease the brightness. And in between work, you have to take some break after 20 minutes. Normally, I say that after half an hour, take a break for the 10 to 15 minutes, look at the distance objects. If you are working in an office, just walk for the 5 minutes, take a break. That will relax your eye. And if you constantly stare on the screen, then after half an and 45 minutes, now you would feel fatigue, soreness, and all these computer vision syndromes will increase, because this cycle will start and start. It will repeat, and your symptoms will increase. Thank you very much. If any question, just let me know. I am happy to answer it.
Thank you, sir, for that in-depth, informative explanation on dry eyes. We will now open the floor to questions from the audience. Participants are requested to raise their hands in case they would like clarification on the topic. I request Devanand Shukla to ask his question.
Am I audible and visible?
Yes, yes.
Good evening, sir. I am Devanand Shukla, student of class 11. So, sir, as today we are in a situation where all our meetings and classes are conducted online on our devices. So, my question to you is, can excessive screen time lead to eye strain? And what is the ideal number of hours for a student to attend online classes?
Yeah, means you can attend the class for 4 to 6 hours, but just when you are attending the classes after half an hour and 45 minutes, just take a break, and you should not stare constantly on the screen. And if you are after this all measures also, if you are feeling that some heaviness, stinging, a burning sensation is there in my eye, then start using one lubricating eye drops. Most of this lubricating eye drops is a preservative free, and when you use, you'll feel that some relief in your eye, no burning sensation and all. So these measures you can do for your excessive computer using.
Thank you, sir.
Welcome.
Can Smaksh go ahead with his question?
Good evening, sir. Am I audible and visible?
Yes, yes.
Thank you for such an informational session, sir. My name is Maksh and I'm a grade 12 science student. My question to you is, can dry eyes lead to glaucoma?
No, dry eye does not lead to the glaucoma. The glaucoma is the separate entity. Glaucoma is the optic nerve disease, and the dry eye we experience on the corneal level. And this optic nerve is present at the inner layer of your eye, and this cornea is the outermost layer of our eye. The dry eye does not lead to the glaucoma. But again, in the glaucoma, when you use the anti-glaucoma medications to treat the glaucoma, that aggravates the dryness problem. Okay, most of this glaucoma patient which is using the anti-glaucoma medications, that comes again and again with the symptoms of the dryness.
Thank you so much, sir.
Welcome, welcome.
Aryan Yadav, please put forth your question to Dr. Kumar.
Hello, sir. My name is Aryan Yadav.
Yes.
Sir, I'm audible.
Yes, yes, you are audible.
Sir, my name is Aryan Yadav from class 6. Sir, I want to ask you one question from you. Sir, what is more harmful for our eyes, mobile or laptop?
The mobile. Again, mobile, because when you use the mobile, the surface area will be the very less. And when you use the laptop, means any electronic gadgets where the surface area will be the more, the brightness effect will be less. And in the less surface area, that will damages more to your eye because of this brightness and all. The mobile are more harmful than this laptops and the computer desktop.
Thank you.
Welcome.
Divyansh, you may proceed with your question.
Good evening, sir. I'm Divyansh Nair, class 9C. My question to you
Yes,
is
sir.
the dry eye affect optic nerve?
Just repeat it.
Do dry eyes
Just
affect
repeat.
optic nerve?
I'm not able to. You just remove your mask and just tell. You are not. Huh. Now tell. Now repeat your question.
Kindly unmute your mic. I think you are muted your mic. Divyansh.
Yes. Do
Yes,
dry
Divyansh.
eyes affect optic nerve?
So
No,
he's
no,
asked,
no.
yeah,
Dry,
yeah.
a dry eye does not damage to the optic nerve. Optic nerve and dryness are the both are the separate entity, and this nothing related to the optic nerve.
Thank you, sir.
Welcome.
Parik, you may proceed with your question.
Good afternoon, sir. I'm Parita Kral, and my question to you is, what are the over-the-counter eye drops available in India for dry eyes?
Yeah, it means when you go to the medical counter, you will get so many lubricating eye drops for the dryness. But all these lubricating eye drops are not good. And if you go with some company, it's a good company, but in Allergan, you can start using the Refresh Tear, Optiv, and all this all drops are very good. But most of the drugs which is available over the counter, they are not suitable for your eye. The better is just consult your eye doctors, and when you consult your eye doctor and take a help from the eye doctors, choose any good lubricating eye drops. Otherwise, if you use some regular eye drops, that will increase your dryness problem, because there will be some preservatives which is harmful for your eye.
Okay, sir. Thank you, sir.
Welcome.
That brings us to the end of our audience questions. On behalf of the headmaster, staff, and students of SelaQui International School, I take this opportunity to extend my sincerest gratitude to Dr. Sanjeev Kumar for taking out time this evening and spreading awareness on a topic of much relevance. I also extend our gratitude to Ms. Pooja Krishna of Oysters HR Solutions Mumbai for initiating this webinar. Now, I would like Ms. Pooja to say a few words.
Miss Pooja, you there?
Yeah, Rajesh, kindly you carry forward.
Yeah. So thank you very much, Dr. Sanjeev Kumar. It was a real insightful session. I think a lot of take-home messages like 20-20-20 principle, have enough water, use bigger screens, and take breaks. These are some of the take-homes I think students would have taken with them. And on behalf of Ms. Pooja Educate Solution, I would like to thank Dr. Sanjeev Kumar for taking out valuable time, and also Mr. Ashford, SelaQui International School, for giving this opportunity, and the students who are part of this program, who I think have got some important take homes and tips for themselves, and carry that home and use it during their online classes. On behalf of Dr. Sanjeev Kumar, I also want to announce that these kind of program will be continuous health education program for SelaQui or other schools across India. SelaQui International surely will get benefited with this kind of awareness. Apart from that, Dr. Sanjeev Kumar is a community man, and he has been doing a lot of services in terms of eye free camps and eye treatments. So he would be very happy if SelaQui International students or staff are getting benefited out of Ramrati Eye Hospital. If anybody wants to take any kind of services from Ramrati Eye Hospital from Dr. Sanjeev Kumar, the school can come and show the eye card and get the benefit of overall services. And the doctor is ready to support you in terms of eye kind of issues and treatment. So that is from Dr. Sanjeev Kumar, and I would like to thank Dr. Sanjeev Kumar for taking this step and volunteering us for this kind of awareness as well as precautionary and treatment steps. So I would like to thank SelaQui International School, Ms. Pooja, Mr. Ashford for giving this opportunity, and Elegant team, and Dr. Sanjeev Kumar for this kind of program.
Yeah, welcome, sir. It's my pleasure.
Thank you. Ms. Pooja, you would like to say something?
Yeah, thank you. My sincere thanks to Principal Sir as well as Mr. Rashford for being continuously in touch with me for arranging this seminar workshop for the students. And it would be great if we continue this since my son has studied from the same school. So it's a privilege for me and also the honored moment that I'm here again with the school. Thank you so much and all the best to all the students.
As we come to the end of this evening's webinar, I would like to conclude with an anonymous quote. We try to hide our feelings with silence, but we forget that our eyes speak. Thank you, ladies and gentlemen, boys and girls. Have a great evening ahead.
Thank you.
Thank you.
Thank you, sir. Thank you. Take care and stay safe.
Thank you. Thank you.